What did we deliver in 2015-16? So delivering standards in critical areas of care is our core business. The main focus in 15-16 was around transfers of care, which makes eminent sense. So the key areas where information is shared either between and exchanged between care professionals or different care settings, and often frequently the area where things go wrong. So that was the main focus, and we developed standards around ambulance handover, discharge from mental health inpatient units, and the electronic discharge summary from acute hospitals to GPs. So really important developments in important areas, and all of those were examples of good practice in engaging and consulting widely in the development. And importantly, not just from a limited group, but actually a really important part of our process is that's really reaching out broadly to hundreds, if not thousands, of people at the grassroots. So there really is genuine consensus and buy-in to those standards. I do want to mention crisis care just briefly, and you'll hear more about it from Mike Part later on. I mention that because it's a slightly different example. It's not the top-down national standard. It was working with the Healthy London Partnership, who had a specific business need and wanted to redesign their services in London, and with great foresight wanted to work with us around that and the records that would underpin that. What I really like about that model is that it's very live and dynamic. It's responding to a real business need, and we're not quite there yet, but what we want to do is work with Mike and the team to get that into practice, to try it out, because we have to start implementing some of these things and seeing how it goes in practice and learning and improving along the way. First and foremost, quite deliberately so at the top there, is empowering patients and the public. And we feel at the PRSB that patients, public, citizens, carers are a really underutilised resource across health and social care. So within our current processes, when we're developing standards, we actually think that's already very good. The way that patients are involved and the citizen voice in defining what those standards should be is actually very good. But we think we can do more. We want to do a lot more on that. And we're actually working with key patient groups to really strengthen those links and the work that we do with them. We also want to really raise awareness amongst the public of the potential here. So thinking of the moves afoot around promoting much more access to health and care information and patients having access to their own records. There's a real potential in that to be another real driver for change. And we're keen to work on that. Leading ultimately to creating patient-centred records. We really hope to be working on records around self-care and how do patients really take control and take accountability for their health, empowered by information and being supported by clinicians and professionals rather than the other way around. We are a UK-based organisation, so whilst a lot of our work has been, pretty much all of our work to date has been commissioned within England, it's really important to us that we do work across Scotland, Northern Ireland and Wales as well. And we've been doing a lot of work around that to strengthen those links. And we all see that there's huge benefit all around in both directions in doing that. So the work that we have done, the standards, have developed, benefited greatly from the input from the other nations. There's been really good learning and really good experience that's fed into those standards. And I would hope in due course that the same would apply in reverse and that we can lead some work from those other nations. Social care. I want to mention social care. We're also, about providing records for health and social care. And if a key thing that we're talking about here is integrated care, getting people out of hospital into the community, cared for at home and so on, how can we possibly talk about that without social care? So I just want to make the point there. The whole advisory board agreed that this is absolutely vital, and we're absolutely determined that health and social care have equal status and that we give due regard and attention to social care. I'm very hopeful. We're having discussions at the moment that we'll be working on standards for discharges into care homes later in the year. So that would be really good progress. They're one of the most complex adaptive changes in history. What's really important about that for me and linking to our work is technology is important in this, but it's not all about the technology. That has to happen, and there's some really difficult things there. But I believe the most important thing and the hardest thing by a million miles is about the change implied. So people who are working with information, people at the front line using this information, having to change their culture, their business practices, how they work with colleagues, how they share information, is profoundly different. And as humans, we're not that good at change, are we? It's always hard. And that's why I think it's so important, and we're so well placed to do work in this area.